Mental health defines our emotional, psychological, and social well-being. It shapes how we think, feel, and act, impacting how we handle stress, relate to others, and make choices. Just like physical health, mental health is vital for everyone at every stage of life. It is important to understand what mental health really is. It is a fundamental part of everyone's life that requires care, as it is complex and dynamic. Crucially, mental health is not a sign of weakness, nor is it all in your head. It is not something you can simply snap out of, and it is never something to be ashamed of. The statistics are significant. Each year, 1 in 5 U.S. adults experiences mental illness, and 1 in 20 experiences a serious condition. Among youth, 1 in 6 experiences a mental health disorder annually. Notably, 50% of all lifetime mental illness begins by age 14 and 75% by age 24. Alarmingly, suicide is the second leading cause of death for ages 10 to 14. You are not alone. Millions are affected by mental health conditions. While prevalence varies, these challenges impact people across all demographics. Anxiety disorders are among the most common, but support and understanding are growing as we acknowledge the prevalence of these conditions in our communities. What causes mental health conditions? They often arise from a complex mix of factors. These include genetics and biological influences, such as brain chemistry, psychological factors like trauma or neglect, and environmental or lifestyle elements, including infections, diet, or substance use. The origins of these conditions are broad. Biological factors include heredity and prenatal issues. Psychological factors encompass abuse, neglect, and trauma. Environmental influences range from family dysfunction and social expectations to substance use and chronic stress, all of which can contribute to the development of conditions like anxiety or depression. Biologically, our behavior is influenced by neurons in the central and peripheral nervous systems. Communication between these neurons is managed by chemical messengers called neurotransmitters. Primary ones like serotonin, dopamine, and GABA regulate our moods and responses. Imbalances in these can impact mental health. Maslow's hierarchy of needs highlights the foundational requirements for well-being. From basic physiological needs like food and sleep to safety, love, and esteem, each level builds towards self-actualization. When these core needs are not met, our mental and emotional health can be significantly impacted. Transitioning to common conditions, we see a range of recognized diagnoses that impact millions of people daily, requiring professional attention and understanding. Some frequently encountered mental health conditions include anxiety, depression, PTSD, personality disorders, bipolar disorder, schizophrenia, sleep-wake disorders, and eating disorders. Substance use disorder is also a critical area of focus that often requires integrated care. The DSM-5 classifies various anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Other categories include separation anxiety, selective mutism, and substance-induced anxiety, alongside various specific phobias like agoraphobia. Recognizing anxiety in friends or family often involves looking for specific symptoms that persist. These include restlessness, chronic fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbances, and persistent physical issues like abdominal pain. The visual manifestations of anxiety disorders are diverse. Common indicators include constant fatigue, excessive worry, internal restlessness, increased irritability, impaired concentration, physical muscle aches, and significant challenges with sleep. It is helpful to distinguish between panic and anxiety attacks. Panic attacks peak quickly, involving intense physical symptoms and a fear of losing control. Anxiety attacks develop more slowly, often triggered by specific situations, and typically persist over a longer duration. Depression is a global concern, affecting hundreds of millions. It is treatable, yet many go without help. Understanding the statistics and recognizing the prevalence across different ages and demographics is essential. If you or someone you know is struggling, resources like the NAMI or the SAMHSA National Helpline are available. Depression manifests in various forms. Major depressive disorder, or MDD, is typically characterized by symptoms lasting at least 2 weeks. Persistent depressive disorder, while potentially less severe, can last for years. Other types include seasonal affective disorder, perinatal depression occurring during or after pregnancy, and depression with psychotic features. When trying to recognize depression in friends or family, look for changes across 4 areas: emotions, thoughts, behavior, and physical health. Emotional signs include persistent sadness, anxiety, or irritability. Thought patterns might involve self-criticism, confusion, or feelings of hopelessness. Behavioral shifts can include withdrawal or neglecting responsibilities, while physical symptoms may include fatigue, sleep changes, and unexplained aches. Managing anxiety often involves a multifaceted approach. Lifestyle changes like maintaining a healthy diet, ensuring proper sleep, and regular exercise are foundational. Professional support such as psychotherapy and, when necessary, medication, whether prescription or alternative, are also common treatment pathways. Always consult with a healthcare professional regarding these options. For immediate grounding during moments of high anxiety, focus on your breathing. Then identify your surroundings using the senses. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This technique can help bring you back to the present moment.